For those of you who are new to our webinar series, this is a project of the Center on Budget and Policy Priorities, which is a nonprofit policy think tank in Washington, D.C. This series is designed to help prepare advocates, assisters, state and local officials, and others to assist consumers access the Affordable Care Act's new health coverage opportunities. It's intended for those working on the implementation of health reform. Today's webinar will discuss updates and changes to the circumstances that trigger a special enrollment period and the timing of coverage effective dates for different triggering events. Guiding us through today's topics will be Shelby Gonzalez, a Senior Health Policy Analyst here at the Center, and Hallie Cloud, the Health Outreach Manager here at the Center. And then at the end of today's presentation, Judy Solomon, the Vice President for Health Policy here at the Center, is going to give us a quick overview of the current healthcare landscape. But with that, I will turn it over to Shelby to get us started.
Thanks, Kyle, and good afternoon, everyone. I'm going to start us off by quickly reviewing enrollment periods. So as you know, the open enrollment period just ended for the fourth open enrollment period. And it's a set time in the year where all consumers can come to the marketplace and they can get their eligibility determined. And if they're a returning consumer, they can change plans or they can opt to stay in their plan. If they're new to the marketplace, they can sign up for new coverage. And it's just worth noting that this is very different than the experience for people who are eligible for Medicaid or CHIP. Those programs are open year-round, so at any point in time, somebody that comes to you and they are eligible for Medicaid or CHIP, you can help them enroll in coverage. So the current plan for the 2018 coverage year, so open enrollment period 5, is that the open enrollment period will start on November 1 and will end on January 31st. But it's worth noting that this time frame could change. We've heard about some efforts underway that maybe would end up shortening the period to end on December 15th. So we'll be on the lookout for any changes and we will let you know. Outside of the open enrollment period, people can enroll in coverage or they can change plans if they qualify for a special enrollment period. These periods can happen at any time of the year, but they're triggered by a specific event that has happened in the person's life. And it's usually people will end up having 60 days after the event has taken place to enroll to enroll in a plan. And generally, the SEP triggering event that occurs to one person in the family creates an SEP for everyone in the family. So, coverage effective dates. Generally, if somebody enrolls between the 1st or the 15th of the month, coverage is effective the first day of the month following the month when the plan is selected. And if somebody selects a plan on the 16th of the month or any time after that until the end of the month, then the plan is effective on the first day of the second following month. I know that's a little confusing to hear. So, for example, today's the 9th of February. So if I select a plan today, I can get coverage starting March 1st. If I were to have selected a plan on February 20th, since it's after the 16th of the month, my coverage would not begin until April. So some SEPs have special coverage effective dates that allow coverage to start sooner, and some SEPs are also available up to 60 days before the triggering event. Now I'm going to turn it over to Hallie, who will give us more detail about the kinds of triggering events for SEPs.
Thank you, Shelby. A little bit later in the presentation, Judy is going to talk more about this, but we just kind of wanted to upfront these qualifying events. These are the rules as they stand now in regulation, and it is possible that the rules around accessing these SEPs will be tightened. So as Shelby mentioned, we'll definitely be back with new information as soon as we have it. One big thing to watch out for, though, is pre-enrollment verification. So we're going to talk about this this process later in the presentation, but essentially be prepared to start submitting documents that prove a person is eligible for an SEP before they can enroll in coverage. People are going to need a lot of help understanding what documents they need and how to get them if they're not readily available, and you guys will be really key to that. You're going to be the ones who are getting people access to these SEPs, so it's really important that you understand the rules as they stand now. That way, when there are roadblocks, you can have some tools you need to get people through the system. So the next section is going to have a ton of information and a lot of lists, and you're not expected to memorize all of this at all. These slides are here for your reference so that you have an explanation of each of these different kinds of triggers that grant an SEP. We also have our SEP reference chart, which we're going to be updating shortly and sending around with these slides. That has a ton of detail on all of these qualifying events and how the timing of each coverage effective date works. But today we're gonna focus on these triggering events, and you can always review the slides or the reference chart or send us questions if you have any questions. So first we're going to look at sort of the broad categories of SEPs that have been laid out by the marketplace. So we have loss of qualifying coverage, which means losing coverage like job-based insurance or Medicaid. We have changes in household size, like getting married or having a baby. We have changes in primary place of living, which basically means moving. Changes in eligibility for financial help, which is a huge, broad category that includes things like moving out of the Medicaid coverage gap, and changes in eligibility for premium tax credits and cost-sharing reductions. There's enrollment or plan error, and lastly, there's other qualifying changes, which kind of encompasses a bunch of narrower circumstances that will trigger an SEP. So first, let's look at the broad category of loss of other qualifying coverage. The first triggering event within this category is the loss of minimum essential coverage. This is probably the most common event triggering an SEP, and it's exactly what it sounds like. If you lose access to other coverage, you can use an SEP to enroll in marketplace coverage. MEC covers a lot of different kinds of coverage, and we have most of them listed here, so you can reference them later. A couple of the really big ones are losing employer coverage, losing Medicaid or CHIP, or aging out of a parent's plan. Important to note that if you voluntarily drop other coverage for whatever reason, you're not eligible for an SEP. So if someone is enrolled in a plan but decides the premiums are too expensive and drops the coverage, they're not eligible for this SEP. However, if you voluntarily quit your job, you are eligible for an SEP if you lose job-based coverage as a result of the voluntarily leaving your job. So there's also a couple specific losses of Medicaid coverage that get their own SEP, pregnancy-related Medicaid and Medicaid for the medically needy. If someone loses one of these types of coverage, or if the coverage expires, that's going to trigger an SEP. In most states, this type of coverage offers full Medicaid benefits and is considered minimum essential coverage. But even if it doesn't, the loss of one of these types of Medicaid will trigger an SEP. For the loss of medically needy coverage, a person is limited to one SEP per year based on the loss of this coverage. Also, medically needy coverage sometimes requires what's known as a spend down. If a person reaches the end of a budget period and their medically needy coverage ends until that person meets a new spend down amount for the next budget period, then this counts as an expiration of the coverage and they can get an SEP in that case. And the last one in this category is the expiration of a non-calendar year plan. This is basically for a plan that ends in the middle of the year. Importantly, this SEP applies even if you have the option to renew the plan. And it also doesn't apply to short-term health plans. If you have a short-term health plan expire during the year, you're going to have to either wait till open enrollment or another special enrollment period that you trigger to enroll in coverage. So what are the coverage effective dates for these SEPs? We're going to have a very long chart at the end of the presentation that lays out all the coverage effective dates for all of the different qualifying events that trigger an SEP. But for now, we're just going to point out when an SEP differs from the regular coverage effective dates, or if it has other special circumstances. So for all of these SEPs that we just talked about, there are two big things to point out. First, you can access this SEP up to 60 days before you are going to lose coverage, or you can access it 60 days after you lose coverage. Coverage either begins the first day of the month after your previous coverage ends, or it begins the first day of the month after you select a plan, regardless of when in the previous month you selected that plan. There is also an exchange option to use regular coverage effective dates. We're focused in this presentation on how healthcare.gov is implementing the SEP rules, but there is some flexibility on timing and a couple of other things that state exchanges can choose to implement. Most states are mirroring the healthcare.gov rules, but if you're in a state with a state-based marketplace, it's a good idea to check to see if any of these exchange options are being taken up. So now let's dive into an example. This is Joe and Danielle, who are both enrolled in health coverage through Danielle's job. In May, Danielle quits her job, and this causes her and Joe to both lose the job-based coverage, and it triggers an SEP. Note that even though she voluntarily quit her job, which we talked about earlier, she is losing insurance because of this, and so she is eligible for an SEP. And even though she is offered COBRA coverage from her job, she doesn't have to take that option and can instead enroll in a QHP through this SEP. Because there is advanced availability for this particular SEP, Danielle and Joe are both able to choose a plan prior to losing the job-based coverage, and their coverage will begin the first day of the month after employer coverage ends. But what happens if they don't pick a plan until after they lose their coverage? Let's say that with everything going on, Joe and Danielle don't have time to complete an application and don't select a plan until mid-July, after they've already lost their coverage. Once they pick a plan, because of the special coverage effective dates for this SEP, their marketplace coverage will begin on August 1st, the first day of the month after selecting a plan. So now let's look at another common set of events that trigger an SEP, marriage and birth of a baby. These ones are just like they sound. If you get married or if you have a baby, adopt a child, or are placed with a foster child, you're eligible for an SEP. You're also eligible for an SEP if you gain a dependent through a child support order or other court order. Now there are some special coverage effective dates for these SEPs. For marriage, coverage is effective the first day of the month after you select a plan. And then for if you add a dependent through birth or adoption, the coverage effective date is generally effective retroactively to the date of birth or to the date of the adoption, to the date of the placement of foster care, date of the court order. And then in some cases, a person can choose to have the coverage start at a later date. So let's look at a pretty simple example for this. This is Jay and Kim. They get married in April. We're going to say that Jay is enrolled in a QHP, qualified health plan, at the time that they get married. So the couple has a few different choices. Kim can enroll in Jay's plan. Kim can enroll in a new plan on her own, or Jay and Kim can enroll in a new plan together. They decide to enroll in a new plan together, and their coverage starts the month after they select a plan. Now, in the regulations, this SEP and a couple of other SEPs that we'll talk about are available to people who are not currently enrolled in any plan. There could definitely be some tightening on these rules in the near future or for 2018, so this is something to pay attention to. For now, these are the rules, so if someone comes in who just got married, just had a baby, and are uninsured, help them get through the system and get enrolled. Our next big category of SEP is change in primary place of living. This SEP has changed a lot in the past year. Previously, anyone who made a permanent move could access this SEP, but now it's limited to those who had some sort of minimum essential coverage at least one day in the previous 60 days before the move, which is a bit of a mouthful. There's one exception if a person is moving to the U.S. from another country or from a U.S. territory. They don't need to meet that one day of MEC requirement. Also, this SEP was going to have advanced availability starting in 2017, but that was amended to be a state exchange option. At this time, healthcare.gov does not provide access to this SEP ahead of the date of the move. Now, what constitutes a permanent move? The definition is pretty broad. Essentially, anytime someone moves and has access to new qualified health plans in the marketplace, they're eligible for an SEP. So this can be moving within the same state, county, even city, as long as new QHPs are available as a result of the move. It's important to note that a permanent move does not include a short-term or temporary move where a person doesn't plan to stay in that new location. But if someone moves for seasonal employment but maintains a home elsewhere, they can still access this SEP in the area where they are working. So how does this play out in an example? This is Daniel, Marie, and Amina. There's a lot going on here, so we're going to take it one step at a time. First, they were covered through Daniel's job while living in Illinois. They voluntarily dropped the coverage in May because it was just getting too expensive. Now, because they voluntarily dropped their coverage, this doesn't trigger an SEP for them. But in July, Marie gets a new job offer in Ohio, and the family moves. Because Marie had minimum essential coverage at least one day in the prior 60 days before the family moved, they're eligible for an SEP. This SEP has regular coverage effective dates. So we're going to say the family picked a plan between the 15th and the end of the month in July. Their coverage doesn't begin until the next following month, which is September. So they're going to have a bit of a gap in coverage. But let's change this example a little bit. Let's say that the family dropped their employer coverage in April. If all the other facts stay the same and the family moves in early July, they're not going to be eligible for an SEP because they did not have coverage in the prior 60 days before the date of the move. They'd need to wait until the next open enrollment period or experience a different SEP qualifying event to enroll in coverage through the marketplace. Also, really important, in this example, we're saying that the family earns too much to qualify for Medicaid, but it's really, really important to remember that people can enroll in Medicaid at any time. And now we get to changes in eligibility for financial help. This encompasses a lot of different qualifying events. I'll try to go through these as clearly and quickly as possible. But if you have any questions, please ask them or email us. So first, we have moving out of the Medicaid coverage gap. We've definitely heard that this one can be a little difficult to access because it needs to go through a marketplace caseworker. But it is available for those who weren't able to enroll in Medicaid because their state didn't expand and their income was too low to qualify for premium tax credits in the marketplace. So how does this one work? If a person has income rise above the poverty line, making them newly eligible for PTC, and they were previously in the Medicaid coverage gap, they qualify for this SEP. This SEP applies in all states. It applies when a person who was in the coverage gap moves to a new state that expanded Medicaid. Previously, this SEP was only available in non-expansion states, and anyone who moved to an expansion state and had a change in income would have been able to get an SEP for making a permanent move. But now that the permanent move SEP has a requirement to have had coverage, this coverage gap one was expanded to make sure that people who are moving to a new state were in the coverage gap and didn't have coverage because of that still have access to an SEP to enroll in the marketplace if they end up having a change in income or household size that brings them above the poverty line. Next, there's when an employer-sponsored plan is no longer considered qualifying employer coverage. This one is pretty jargony, but basically, if employer coverage is both adequate and affordable, then a person is ineligible for PTC. Now, if someone enrolls in that employer coverage and then there's a change to the coverage, so it either changes its benefits, so the plan is no longer adequate, or the cost of the employee coverage goes up and it's no longer considered affordable, then that person is eligible for an SEP to enroll in marketplace coverage. However, the person must drop their employer coverage before they can enroll in a plan with PTC. This is a weird one and seems pretty similar to the loss of other qualifying coverage, SEP, but the important thing to remember is the employee doesn't have to actually lose this coverage to be eligible for the SEP. There's also newly becoming lawfully present, which means that someone becomes newly eligible for marketplace coverage because of a change to their immigration or citizenship status. If someone had an immigration status that was considered lawfully present, like they had an LPR status, and then they gained citizenship, they're not eligible for this SEP because they were already eligible for marketplace coverage based on their LPR status. This SEP only applies to those who newly gain an eligible status, so that can be confusing, but that's how that one works. We also have release from incarceration, which is pretty self-explanatory. And then we have status as an American Indian or Alaskan Native. This SEP applies to members of a federally recognized tribe or dependents of a member of a tribe. Basically, tribe members and their dependents can use this SEP once a month to either newly enroll in or change QHPs. The next two SEPs are only available to those who are currently enrolled in marketplace coverage, and they're connected, so we're going to talk about them together. If you have a change in income or household size that either makes you newly eligible or ineligible for premium tax credits, or the change affects your eligibility for cost-sharing reductions, then you can access an SEP to change plans. So this would apply if someone was at 400% of the poverty line, and then their income drops, or over 400% of the poverty line, and then their income drops to 350%, and they become newly eligible for PTC. It also applies if someone crosses into a different level of cost-sharing reduction, so that if they were at 220% of the poverty line and then drop to under 200, that would make them eligible for a more generous level of cost sharing, and that would qualify them for an SEP. Now, some of these have some special timing rules. The biggest one is the employer plan no longer being qualifying coverage. That has the same special timing rules as the general loss of coverage SEP. So there's advanced availability, and the coverage begins the month after plan selection. And we already talked about the special rules for federally recognized tribe members and their dependents, where they can enroll in or change QHPs one time per month. The coverage effective dates for that one are going to follow the regular coverage effective dates. So let's do an example. This is George. His income was below the poverty line at the time of open enrollment, and he knew his state didn't expand Medicaid, so he didn't apply for any coverage. Later in the year, he gets a new client, and his income rises above the poverty line. He is eligible to newly enroll in marketplace coverage with PTC, and he picks a plan at the end of June. His coverage begins August 1st, the first day of the second following month after he selects a plan, which is in accordance with the regular coverage effective dates. Important to note here that as the rules stand now, George doesn't have to have had any prior contact with the marketplace in order to be eligible for this SEP. And in our next example, we have Chad and Moesha. At open enrollment, they had income above 400% of the poverty line, so they were ineligible for any subsidies in the marketplace. They decided to enroll the family in a low premium, high deductible bronze plan at full cost. In June, their income goes down, and the family is newly eligible for PTC in the marketplace. Because they're already enrolled in a QHP, they can now change plans, and they decide to enroll in a silver plan with much lower cost sharing. So now we're going to move on to our final two categories of SEPs. All of these SEPs have coverage effective dates that are appropriate to the particular circumstances. So that can mean special coverage effective dates, retroactive coverage, or regular coverage effective dates, depending on each individual situation. And the timing of these SEPs are all going to depend on that situation as well. So the first SEP is any kind of error, misrepresentation, or inaction by the marketplace, by HHS, by a broker, by an assister, by an insurer, or anyone else who's providing enrollment assistance. This is a big, somewhat broad category, but if an error or misrepresentation happened, like a person was told by an insurer that a specific provider was in network, but then that doctor wasn't in network for that plan, it's really worth trying to get an SEP for this person. The marketplace is ultimately going to determine if the person is eligible for an SEP, though. This category also includes plan or benefit display errors. So if something was displayed wrong on healthcare.gov or on a state-based marketplace website, and that influenced the person's decision to either enroll or to not enroll in that health plan, there's an SEP for that. And again, the marketplace determines if this applies. We also have a health plan violation, which is when a plan violates part of their contract. Now, our last category is a bit of a catch-all. The first one we're going to go over is being determined ineligible for Medicaid or CHIP. This is for people who are transferred to or applied directly to a state Medicaid agency during an enrollment period, and then they were later determined ineligible for Medicaid. But by the time they were sent back to the marketplace to enroll in coverage, the enrollment period had ended. And this SEP allows these people to enroll in coverage since the delays in their eligibility determination were beyond their control. This mainly applies to people who are ineligible for Medicaid due to their immigration status. And then we have resolving a data matching issue. So if a person applies for coverage and gets a data matching issue, they basically have temporary eligibility for coverage. For this SEP, what happens is the person was unable to resolve the DMI in the time allotted, and their coverage was terminated as a result. If the person is able to resolve their DMI after the coverage is terminated, then they're eligible for an SEP to re-enroll in coverage. This SEP also applies to people with income under the poverty line who are ineligible for Medicaid due to their immigration status and were delayed in enrolling for coverage because they were waiting for the marketplace to verify their eligibility for premium tax credits. Also, we have an entire webinar on preventing and resolving data matching issues. So if you have any questions on data matching issues and how they work and how you resolve them, definitely look at that webinar on our website. We also have an SEP for victims of domestic violence or spousal abuse or spousal abandonment and their dependents, which will enroll, it allows them to enroll in coverage separate from their abuser or spouse. Note that this only applies to those already enrolled in some form of minimum essential coverage. We also have exceptional circumstances, and this is a really big other category. It includes any exceptional circumstances like a natural disaster or medical condition that kept a person from enrolling during open enrollment. If you think you have a case for exceptional circumstances that affected a person's enrollment, then it's worth a try to get this SEP. Now we're going to go through our last example in this huge section. So this is Roberto and Monica and their two children, Miguel and Elena. Monica got a data matching issue regarding her citizenship when the family applied for coverage during open enrollment. She enrolls in coverage with her family, but is told that her eligibility is temporary and she needs to send in documentation to prove her citizenship. She doesn't have all the documents on the list to resolve her DMI, so she sends in what she has and starts the process of applying for a second document that is needed. By the end of March, her temporary eligibility expires and her DMI is still unresolved, so the marketplace terminates her coverage. In April, she receives the needed document to resolve her expired DMI, and she sends it in. In May, her DMI is resolved, and she's granted an SEP. She re-enrolls in her plan in June and is actually able to have her coverage start retroactively back to the day after she lost coverage in March. She's going to need to pay all the premiums for those months in between, so April through June, if she wants to reinstate her coverage retroactively. So with all of that, we're going to turn it over to Shelby. He's going to go over some of the events that do not trigger an SEP.
Great. Thank you so much, Hallie. So now that you know that what does trigger an SEP, I'm going to go over some things that don't. Obviously, we can't go over the whole universe of things that don't, but here's some common things that people sometimes get confused about. So first, I should also say that the list that I'm going to go through is very specific to how things are done in healthcare.gov. A lot of states are very similar to what happens in healthcare.gov, but there might be some variations, so it's important for you to reach out to your state and understand what the rules are in your state if you have a state-based marketplace. So first, voluntarily dropping coverage is not going to trigger an SEP, and Hallie already talked a little bit about that. Sometimes this gets confused a little bit because people think, well, wait a minute, I voluntarily stopped working at Acme Corporation. Does that mean that I have voluntarily dropped my coverage? No. In that case, you've decided to change jobs and your coverage has been lost as a result of that. That's not a that would trigger an SEP. Losing eligibility for coverage would not trigger an SEP, would not be a triggering event if the person was not previously enrolled in that coverage. So in this case, you're thinking about a person who maybe had an offer of employer-sponsored coverage but didn't opt to enroll in that coverage, and then they lost that job, they changed jobs. That's not a loss of MEC that would qualify you for an SEP. So, being newly eligible for a premium tax credit does not trigger an SEP, but there are two exceptions of this, and Hallie covered these. And if a person's coming out of the Medicaid coverage gap, that's one time that there's an exception for this. That is a person who's newly becoming eligible for a PTC, who was previously not eligible for neither Medicaid nor premium tax credits because their state chose not to expand Medicaid. And also, in the event that somebody is enrolled in a qualified health plan but was not eligible for a PTC, in that case, they're also able to have an SEP as well if their circumstances would change and now they became eligible for a premium tax credit. Being terminated from coverage because a person fails to pay a premium or maybe committed fraud, there's no SEP for those kind of circumstances. Divorce or death don't trigger an SEP. But if the person loses coverage as a result of divorce or death, then they could qualify for an SEP, but because that's a loss of coverage SEP at that point. There are some this is one of those that there might be some differences in your state-based marketplace. For example, people who are in a qualified health plan in some states, and then they experience either death or divorce, those people might be able to switch SEPs. They might have an SEP. Switch QHPs. They might have an SEP that allows them to do that. That's just not something that happens in states that use the healthcare.gov marketplace. Becoming pregnant does not trigger an SEP. And moving from one place to another place within the U.S. Does not trigger an SEP unless the person had coverage for at least one day in the last 60 days, as Hallie explained. So we're going to do a quick example. This is Carla, and she's experiencing an income change, and she's also losing that opportunity to have employer-sponsored coverage. So Carla's employer offers coverage, but she chooses not to enroll in coverage. In May, her hours at work are reduced, and as a result, she no longer is eligible for employer-sponsored coverage. Her income also drops because of the reduced hours, and now she no longer has access to employer-sponsored coverage, and she now newly became eligible for a premium tax credit, but she doesn't qualify for an SEP, so she will have to wait until the next open enrollment period to enroll in coverage. Now let's go through some of the process for accessing SEPs. As important background, people who are enrolled in marketplace coverage should report when there are changes in their life to their marketplace. Some changes will trigger an SEP and others won't. Things to report include things like income changes and gains or losses in health coverage, changes to your household, corrections to information that you provided, like an SSN or maybe your name change or something like that, changes in your tax filing or your immigration status, if you're moving. All of those kinds of things are things that you want to report to the marketplace. A little bit more on moving. If you're moving within the state, you report that change in the application that you originally used to enroll in. If you are moving outside of the state, you should also report that change to the marketplace that you were previously in, but then you're also going to want to report that change in the new marketplace application as well. So just important to note that those kind of changes require you reporting in both places. When accessing an SEP, those already enrolled in marketplace coverage should return to the application and report a change. Then they will go through each of the parts of the application and make any changes as needed. And those who are not already enrolled in coverage should go through the go and start a whole new marketplace application. And in both cases, at the end, when the application is newly submitted, the application will generate a new eligibility determination. And oftentimes, that eligibility determination will also reflect eligibility for the new SEP. There are certain exceptions to that, and in those cases, to generate or to activate an SEP, you would actually have to call the marketplace call center, and in some cases even go through a caseworker to help you activate an SEP. But assuming that your eligibility determination notice indeed generated this SEP, the consumer will also be able to immediately move into the plan select section of the application, and they can select their plan and enroll at that time. States that use healthcare.gov have a confirmation process for SEPs, and other states may also have followed kind of suit as healthcare.gov, but some don't. So this is another area where if you are working in a state that has a state-based marketplace, it's just important for you to go ahead and contact your state to find out kind of how that works. So I'm going to be describing what happens in healthcare.gov. So in healthcare.gov, people who qualify for certain SEPs have to provide documents that show that they are eligible for an SEP based on a triggering event. The SEPs that currently require documentation include loss of minimal essential coverage, permanent move, birth, adoption, foster care, or some kind of change because of a child support order, marriage. And currently, customers can enroll in the plan and will have to send in sufficient proof of this triggering event afterwards. But there's no kind of interruption immediately. They're able to go ahead and enroll in a plan and then move forward and send in documents afterwards. So we have a bunch of lists that show exactly what kind of documents can be sent in each of these kind of different triggering events I will not be reading these lists to you, I promise you. But you can see that different, this is a permanent move. There's all sorts of different documents you could send in, birth, there's just a lot of different documents that can be sent in, and good news, nobody has to memorize them. Those are there as a reference for you so that you can come back to them whenever you need to and help somebody get those documents in. So changes are coming to SEP enrollment processes in states that use healthcare.gov. We don't know a lot yet about this, but we do know some information, and here it is. So first, HHS is currently aiming to have a new process for providing eligibility for SEP starting the 1st of June. 50% of applicants will have to provide proof of eligibility for an SEP before they enroll in coverage. So that's a big difference, right? Right now in the confirmation process, you enroll and then you provide the proof afterwards. This would switch that up for certain people and make that happen beforehand. So that's a big change. People in this group will be able to submit their applications and they'll be able to select a plan, but it will be pending until they submit sufficient documentation that they qualify for an SEP, and the marketplace reviews that information and they process the documentation. There will be 30 days for this to happen, and that's a lot. That is not a lot of time. When you think about, consumers don't always have these documents handy. They may need to call their old health plan to request documents in some cases, or who knows. They might also be confused by this whole process. And this is where they're really going to need your help. Doing what you can to make this happen as quickly as possible will go a long way for consumers. Generally, coverage effective dates will be the original coverage effective dates, just as they are today, based off of when they select their plan. But if there is a significant delay of 2 months, some consumers will be able to select a prospective effective date. So that's something else that people might need help in understanding what their options are. We don't know if this, if the documents that are currently being used for the confirmation process will also be used in the new process, but we assume that the list will at least be somewhat similar. We don't know if the new administration will make any other changes to the current plans. We've heard that it's possible that a new rule will be coming out soon that will that will expand the pre-enrollment verification. So perhaps maybe it wouldn't just be limited to 50% of applicants. Maybe it's more. We don't know. But we are monitoring the situation very closely, and we will let you know if anything does change. Oh, sorry. So we have also included here a copy of a reference chart. This is right now in the process of being updated, and the updated version of it will be sent out with all the other materials for the webinar that you'll get shortly from Hallie. And as Hallie mentioned earlier, that we have this great chart, and we will promise not to read it to you here, and you'll get an updated version of it in your email box soon. We've also included some resources, including very, very important, the regulations where all of the rules kind of live for this area of work, and some additional information. And our contact information, as always. And I think that we are now turning it over to Judy.
Did you want to do questions? Or?
Oh, yeah, we can do questions first.
Yeah, I only need like 5 minutes.
Okay, yeah.
Okay.
All right, so we'll start with some questions. This first question is, does an SAP qualify for someone who has turned 19 who had Badger Care, so presumably aged out of CHIP or Medicaid?
So that's a good question. If you age out of Medicaid and it's no longer available to you, that is a loss of coverage, and you do get an SEP for that.
Next question for For the having a baby SEP, can the entire family sign up for a new plan on the baby's date of birth?
Yeah, generally that effective date is going to be the same for everyone. So the plan starts on the date of birth for the baby for everyone who's in that plan.
Next one, will a consumer qualify for an SEP if a couple that is not married has a baby?
So this is a bit of a tricky one. So if someone has a baby, it triggers an SEP for everyone who's in that enrollment household. So it depends on whether they can enroll in a plan together is kind of the answer. It depends on the situation. Some unmarried couples, one partner will claim the other one as a tax dependent. In that case, they're going to be in the same household. But if they're both sort of filing separately, there are situations where a plan might let them enroll together, but there's a lot of situations where they won't. And if they can't enroll together, then they wouldn't be able to get that SEP altogether.
The next one, can you explain a little more about the going above the poverty line SEP, particularly related to some of the documents that are needed?
So for right now, that one is not one that needs documentation, but it does have to go through a caseworker. So that is for people who are in the Medicaid coverage gap. So they're in a state that did not expand Medicaid. So their income is too low to qualify for premium tax credits, and they can't get Medicaid because their state didn't expand. So they're kind of in this weird limbo.
And just to add, is because that's, well, one, I should say that that's a hard one to get. We've heard a lot of the sisters tell us that they've worked really closely with families and it's been difficult to get. But two, since it's in the casework process, technically we probably just don't know if within that casework process somebody might say, we want you to prove that your income was at a certain level beforehand.
Yeah.
So we're not sure because I think that there's probably some discretion on the caseworker that's working with the family. So
yeah, to make sure that someone is eligible for that SEP, and we're really not very sure on how that process works. We just know that it goes through casework.
For income changes, how big of a change in income needs to be reported? So for instance, what if it's about $500 in a year?
It's kind of a judgment call. I mean, any change in income that affects sort of where you are, the percent of income on the federal poverty line, that's going to change how much premium tax credit you're eligible for. So if you have premium tax credits, it's a pretty sensitive calculation. So you'll want to, if it's a significant change in income, you definitely want to report it. You don't have to report every little dollar that you get, but I definitely would recommend over-reporting as opposed to under-reporting, I think.
I would just add one quick thing is that it is tricky sometimes, right? Because let's say it's because of an application process issue that sometimes it can get tricky. And this is because if you report just every single change, and let's say that there is a change in the level of cost sharing reductions, or you get cost sharing reductions, you don't, that may trigger an SEP where one might not want an SEP to be triggered, and then it's unclear how easy it is for the consumer to then go through the application process and make sure that, like, maybe I've paid a whole lot of money towards my deductible and I would really like to keep my plan, So there's some trickiness involved in this and a lot of help. The sisters who know this process really well, this is a really great place for them to be providing a lot of one-on-one assistance and some guidance. But yes, generally you do want to make sure the marketplace knows how much your income is so they can do some readjustments, but it is a little bit of a tricky situation.
Yeah, it's kind of, if you think your income is going to be really different from what you projected your income to be on the original application, you're going to want to make that change. And as Shelby said, you do not have to change plans. You can stay in the same plan. So that is it. You don't have to use the SEP.
Mm-hmm.
Which SEPs are only available at the Marketplace call center?
So we're not going to go into all of them, but our SEP reference chart has sort of a basic guide for it, for which at least which SEPs are available through the application. So that can be kind of a handy guide. Things can always change, but this is from the best information that we have, at least the ones that are available through the application. If they're not available through the application, then you have to go through the call center or casework.
If someone qualifies for multiple SEPs, can they lose tax credits if they only provided documentation requested for one of the SEPs and not the other one?
So as far as we know, you only have to prove eligibility for one SEP because you only need one SEP to change plans. So if you're eligible for two, you only need to prove eligibility for one.
In the application, your eligibility determination notice is going to pick one. It's going to pick one for you, and it will say send in documents for this one, and that's the one you should be sending documents to prove. Yeah.
And then our last question, if someone found out that they had cancer after open enrollment ends, can they qualify for an SEP?
And the answer to that is no. You have to have one of these qualifying events to get an SEP.
And with that, I think we'll turn it over to Judy to close us out.
Hi, everybody. This is Judy. For those of you who don't know me, I am one of the two VPs for our health policy team here at the center, who you've been hearing from and are wonderful. But I just wanted to sort of get on and talk to you a little bit about what's going on here in DC around the ACA, and really just sort of stress the importance of what you're doing every single day to make sure that even in this time where a lot of uncertainty is actually being roiled up, that you're kind of continuing to do the work that you're doing. And at the end of the day, I think that is just going to be incredibly important in keeping people covered and making them have the ability to get covered. So I just wanted to sort of highlight a couple things. I mean, first is that we are still here, and you are obviously all still here in tuning in to us today. Nothing has really changed. I think some new things coming on the SEP verification process were highlighted, and we actually may see more of those things within the next couple of weeks in a proposed rule, and we'll be definitely keeping you informed. But right now, I think the really important thing is to make sure people effectuate their enrollment, all the people that you helped enroll, that they pay that first month's premium and they resolve any data matching issues. I think Shelby mentioned or Hallie mentioned that we have a webinar for reference on data matching issues that you can go to. But maintaining people's enrollment and is just going to be so important. And then I think as the year goes out, I think we wanted to do this SEP webinar because we know it's just going to be harder for people to get an SEP, and they're going to need more help from you all. So I think as much as you can to make sure that your outreach is making people aware of when they may have an SEP and help them through the process. I mean, that's pretty much all I wanted to say. We're still here too. We'll be here through the year. We will continue our webinars, materials, and in the fall, our 4-part basic series on the ACA, and are able to continue to answer any questions you have. And then, as I said, finally, we will be coming back with anything on changes as they occur. If there's particular areas you would love to hear, if there's a webinar you think we should do, just let Hallie know or use the general mailbox. And that's pretty much all I had. But don't feel free to email any of us with any uncertainty or so on. And then the general CBPP website is the place to go to be up to date on all things around the debates on the ACA as well as on Medicaid. So I would encourage you to go there if you want to know kind of what's up and what some of the issues are and how they're playing out.
If you have any questions or need any assistance going forward, please email our Beyond the Basics contact email at beyondthebasics@cbpp.org. And with that, we'll bring this webinar to a close today. Thank you, everybody, for joining us.